Hello everyone, welcome back to Meditips. It's been a long time I've posted a video here because of my busy schedule. Today we are going to talk about a most commonest orthopedic condition, a type of arthritis which affecting millions of people worldwide and which causes pain and stiffness to the joints, and it's become severe enough to make daily tasks difficult, and also it leads to functional disability. It is osteoarthritis. Of course, everyone knows osteoarthritis. But do you really know what are the treatment options that is available today for osteoarthritis? Do you know the importance of physiotherapy in conservative and surgical management of osteoarthritis? Have you heard about Mako robotic surgery, the new surgical option that is available today? In this video, you will get overall information about osteoarthritis and its treatment. And to talk on this topic, today we have a great personality with us who always works hard for his patients and who has a lovely combination of professionalism and caring towards his patients. And he is none other than Dr. Jay Tilak. Yes, he is one of the best orthopedic surgeons that we have today with his dedicated service, care and effectiveness of treatment. He is working as clinical professor in Amrita Institute of Medical Sciences and Research Center, Kochi. He was certified for robotic arm-assisted joint replacement surgery by the Mako training program in the US. India's first robotic arm-assisted surgery was started in Amrita Institute of Medical Science and Research Center, Kochi in 2018. He has been privileged to do more than 4,000 joint replacement surgeries and 5,000 arthroscopic surgeries, mainly of knee, hip and shoulder. I fully appreciate him for giving his precious time from his busy schedules to this video, and let's see his valuable opinion about this topic.
I'm Dr. Jay Tilak, clinical professor and senior consultant in Amrita Institute of Medical Sciences. My specialty is joint replacement surgery and arthroscopic surgery of the joints. We have more than 20 years of experience in this hospital after starting the joint reconstruction division. We have done more than 5,000 successful joint replacement surgeries, and currently the latest addition to our joint replacement program is the Mako robotic surgery, which is the first in India. Talking about the arthritis of the joints, the most common joints which get arthritis as far as orthopedic division is concerned is the knee joint and the hip joint, even though the other joints also may be affected due to different conditions. The arthritis can be broadly classified into osteoarthritis, which is nothing but the wear and tear of the joints, the cartilage inside the joint. And there are also other type of arthritis which can affect the joints, like the inflammatory or the rheumatoid arthritis, which is due to a systemic disease due to inflammation which destroys the many joints in the human body. And there are also other arthritis like secondary arthritis following a previous history of trauma or an accident where the joint is involved, or there is a fracture inside the joint, which can lead later on to a secondary arthritis. So these are the common broad categories which we see every day in our outpatient department. A patient comes with osteoarthritis to our outpatient. We initially treat them depending upon at what stage their arthritis is. In the early and moderate grades of arthritis, we treat them basically with medicines to control their pain and then advise them physiotherapy exercises with the help of the physiotherapist to build up their muscle strength and their range of motion, which to a large extent helps them control the pain and get on with their day-to-day activities. So in the first few stages, in the early stages of osteoarthritis, in most of our patients, it's just medicines, tablets, along with exercise, activity modifications, reduction, advising the patient to reduce their weight if they are overweight. All this helps them tremendously. Once even the arthritis reaches a bit more advanced stage, when there is not much control with these medicines and the arthritis, the next modality we might advise the patient is intra-articular injections of either hyaluronic acid, which is a kind of lubricant into the joint, or sometimes nowadays we also try to give PRP injection. PRP is nothing but platelet-rich plasma, where we take the patient's on blood and then centrifuge it and take a concentrate layer of platelet-rich plasma and inject. There are also other intraarticular injections which are currently available, like stromal vascular fraction and also BMAC injection, which is the bone marrow aspirate concentrate injections. All these are a little bit still on the research phase, but people have been requesting, and it is available for people who are willing to try all these injections before jumping onto a surgery or the last option. So in moderate amount of arthritis, these are the modalities of treatment what we usually recommend. Once the conservative line of treatment like tablets, physiotherapy, weight reduction, intraarticular injections doesn't work, or the patient has reached an advanced stage of arthritis where almost the bones are rubbing against each other because of the wear and tear of the cartilage, that's the stage when we recommend the patient the surgical option. The surgical option depends upon what type of arthritis or which compartment in the joint. Especially in the knee joint, we divide the joint into a medial, lateral and a patellofemoral component. So depending upon which area of the knee joint is involved and how active the patient is, what is the age of the patient, we decide on surgical options. The surgical options available to us are either partial knee replacements, which is also known as unicondylar knee replacements, and also we have the patellofemoral replacements, and then finally, if all the compartments, if there is a tri-compartmental involvement of the arthritis, we suggest a total knee replacements. So this has been very actively done in our hospital for the past 20 years, and we have easily done more than 5,000 joint replacements as of now. The latest technique what we have in our hospital is a robotic arm assisted joint replacement surgery. The robot we have is known as the Mako robot, which is one of the most advanced available in the world, and we are happy to say that we are the first hospital in India to acquire it, even though there are currently just 3 units in the whole of India. The advantage of Mako robot is that it gives a very precise cut to the bone. The preparation of the bone is extremely precise, and also the injury or the damage which we can cause when we prepare the bone with the saw blade is much controlled, because the robotic arm has a haptic boundary that it controls the movement of the saw, and the damage which caused to the surrounding tissue by the saw is reduced dramatically. In the process, the pain which causes after the surgery is much less during a robotic surgery compared to a routine surgeon-based or a jig-based surgery. So that is one of the biggest advantage what we have noticed in our patients. Any major surgery in elderly people, we usually do these joint replacements in people who are 60 years and above when they have tricompartmental arthritis. So most of the patients, especially in our state in Kerala, there is a huge population of patients who are diabetic, who have blood sugar values little high. So one of the complications we always explain to the patient following any major surgery, especially those surgeries which we involve joint replacement, where we put in an artificial joint inside the knee joint, the chances of infection, it is considered as it is less than 0.5% in our hospital. But whatever said and done, we always explain one of the major complications which always the patient has to keep in the back of the mind is the chance of infection. Another complication which has to be known to the patient is, like any major surgery in elderly population, there is a complication known as deep vein thrombosis, where the blood clot forms inside the blood vessels, and if unfortunately the blood clot gets dislodged and if it reaches the heart or the lungs, it's a dangerous condition. But again, the incidence is extremely low. We take all the precautions against this deep vein thrombosis complication. But these are the 2 major complications which we always explain to our patients who have decided to undergo a joint replacement surgery. Some of the patients are so scared to undergo surgery that they try to prolong it as much as possible. But once there is a tricompartmental arthritis and the patient is really struggling to have a day-to-day activities in a normal fashion, that is the time when they take a lot of medications, painkillers, which is, in a long term, most of the painkillers are really bad for the kidneys especially. It can cause renal damage, kidney damage, and sometimes if you take it on a long basis, patient can develop gastritis, peptic ulcers, and also to some extent osteoporosis of the bone. And again, if you keep on prolonging those joint replacement surgery in indicated patients who have started developing deformities like bow-legged or knock knees, what happens is the ligaments around that joint slowly stretch. So the more deformities, it becomes a little more difficult for the surgeon to operate at a later date, because balance those ligaments and get a good functioning normal knee joint, it's much easier one if the deformity is less. So patients who really need surgery, who have attained a tricompartmental arthritis with a lot of pain which is not relieved by conservative treatment, it may be sensible to get the operation done rather than wait for a long period and have the gross deformities with a lot of bony erosions, where the surgery is a little more difficult and it needs a lot of expertise from the surgeon's side to balance that knee well and make it as normal as possible. In our institute, immediately after the surgery, we make them stand and walk and start the physiotherapy on day one, that is on the day of the surgery, in most of our patients. And once they get their initial walking and standing confidence, it's much more easier to rehabilitate the patients very fast. So on an average, they stay for about 2 days in the hospital after the surgery, and that's the time when we advise them to get their confidence back, to get them up, take a few steps, and by the first or the second day they will be automatically walking till the toilet for their day-to-day activities, and continue with their knee exercise. So we do make them stand and take a few steps on day 0, that is on the day of the surgery. And if the surgery gets over towards late in the evening, probably the next day itself. So it is immediate rehab and ambulation and walking as far as the exercise and physiotherapy is concerned. After the operations, once the knee becomes quiet and patient follows the physiotherapy exercise very religiously, then we can say that the knee almost gets back to normal function, what that patient needs. But we always warn the patient that the total knee replacement is not something where the patient should expect something the knee function had when the patient was at the age of 20 or 25. The knee will never be like that. But what we are aiming for is a very painless functioning knee where they can do almost all their day-to-day activities normally, like walking, going for shopping, going for evening walk, morning walks, or climbing stairs, going up and down. All these activities are allowed. Even mild, moderate kind of exercise, recreational games, all these are allowed. But heavy activities like playing football, basketball, or heavy or long distance running, all these are kind of not really recommended, because we know the knee joint has a life expectancy. So we always advise the patient that the artificial joint on an average lasts about maybe 15-20 years or even more in some of the latest generation joints. But for that joint to last so many years, it is better to avoid heavy activities or heavy sports. We always advise the patient that the operation is very important as far as the implant is kept inside the joint and how the ligaments are balanced. But much more important is post-operative rehab. So once the patient, from day 1 onwards, we have to advise the patient regarding what all exercise, physiotherapy, how to walk, what all things they have to do. So the first 1 to 2 months is the most critical period as far as we are concerned, where we advise the patient to religiously follow the exercise pattern prescribed by the physiotherapist. Once they follow what has to be done, that is what that patient is going to get for the rest of her life. So it is extremely important how they follow up the advice given up by the physiotherapist regarding the knee range of motion exercise, the muscle strengthening exercise, the gait pattern. All this has to be followed religiously by the patient, and we also teach the bystanders of the patient how to advise this patient, how to encourage the patient to do these exercises as much as possible. So I would say it's extremely important that the patient follow the advice given by the physiotherapist and the operating surgeon how to go about the knee post-op rehabilitation. The rest of the video will be about the physiotherapy management of these patients after their surgery.
When we talk about the rehabilitation aspect of osteoarthritis along with medical management, physiotherapy is an important part of conservative treatment of osteoarthritis. If conservative treatment fails and if there is strong evidence of osteoarthritis, then surgical options can be considered for pain relief and to improve quality of life. As the first line of conservative treatment, the role of physiotherapy is to educate the patient. Physiotherapist will make you understand what is osteoarthritis and what are the proper exercises that will help you to relieve your pain and to improve your functional ability. And physiotherapist will also help you to reduce your weight if your BMI is above 25. BMI means the body mass index, that is the ratio between your body weight and your height. It should be below 25. If you have BMI above 25, you should reduce your weight. Physiotherapist will help you to modify your activities of daily living, and also you will be advised to use offloading braces if you need it, like the braces which will help you to shift your body weight load from your involved knee compartment. Exercises like ankle pumps, static quads, SLR, knee bending and straightening, VMO strengthening, all are very, very important aspect of physiotherapy treatment. And your physiotherapist will teach in proper way how to perform all these exercises and what are the importance of exercises in osteoarthritis. In this video, I'll teach you all these exercises, that how these exercises have to be performed. But I would like to remind you one thing: before performing all these things, you should have to consult with your doctor and you have to take instructions with your physiotherapist. When we talk about the rehabilitation of surgical aspect, that is total knee replacement, we should have to understand that it should begin as soon as possible. Yes, that means you can start your exercises and walking from the day of surgery. The pain which was present in your knee before the surgery and the pain and swelling which will come after surgery may become a challenge for your exercise. By doing all the exercises and walking activities, you will reduce your pain. You may feel uncomfortable at first, but appropriate exercise will help you to speed your recovery, and it also helps to relieve your postoperative pain. It helps to prevent some complications like deep vein thrombosis and swelling in and around the knee joint, effusion of the knee joint, and it also helps to improve blood circulation. Before starting exercises, I would like to make you familiar with some of the supportive and assistive devices that you're going to use after your surgery. I'll explain how to use this and for what purpose you have to use all these things. First one is crepe bandage. You will be having a crepe bandage compression wrapping from your mid-thigh to mid-foot for initial 2-4 days after surgery. This is mainly to reduce postoperative swelling around the joint and to prevent joint effusion. After 3-4 days, this compression wrap can be reduced from mid-thigh to mid-calf. But you have to use this compression wrap for around 1 month to prevent further joint effusion or swelling. Second one, knee brace. Universal knee brace will be worn for initial 2-3 days after surgery to assist with walking. After that, when you develop your knee strength, you can remove or discontinue it. Your physiotherapist will teach you how to walk with proper knee lock after removing your brace. Third one, walking aids like walker, crutches or cane. For giving you stability and support and making you more comfortable in standing and walking, you may have to use proper walking aid after your surgery. Your physiotherapist will clearly instruct you how long you have to use this walking aid. So, these are the things that you have to be familiar with after your surgery for some times. Now, let's see the exercises. In physiotherapy, we have a lot of exercises, but for this concerned topic, we have some appropriate exercises that I'm going to teach you here. I'll divide these exercises in 2 phases. First one is early postoperative phase, that is going to start soon after your surgery. And next one is advanced exercises and activity levels. Early postoperative exercises you can start from the day of your surgery and you have to continue this up to 6 weeks after your surgery. And advanced exercises and activities you have to start only after review with your doctor, that means after 6 weeks of your surgery. Here I will teach you one by one each exercises, that means how you have to perform properly all these exercises. First one is ankle pumps and toe movements. For doing toe movements, you have to move your toes 10 times rhythmically. And for doing ankle pumps, you have to move your foot up and down rhythmically by contracting your shin and calf muscles respectively. Perform this exercise 10 to 15 times in 8 to 10 sessions a day. The main purpose of this exercise is to prevent DVT, that means deep vein thrombosis, the major complication that happens after surgery, and edema, and also it increases the blood circulation of your limb. Next one is quadriceps sets. It is otherwise called static quadriceps exercise. Quadriceps is the main and most important muscle of your front thigh. It is the main muscle which helps you to stand erect by making your knee straight on standing and walking. For doing this exercise, you have to tighten your front thigh muscle by pressing your knee downwards to a small roll of towel and make your knee straight and foot up for better results. And try to hold your limb in this position for 5 to 10 seconds and make it relax. Again, repeat the same exercise. So, holding muscle in this contracting position for a while will help to improve muscle strength. Quadriceps is the main muscle which helps you to stand properly, walk, run, and move around with ease. They also helps to keep your kneecap stable. Next one, SLR or straight leg raise. For doing straight leg raise, you have to tighten your thigh muscles with your knee fully straightened on the bed and keeping your foot up. Then lift your leg 8 to 10 inches from the bed and hold for 5 to 10 seconds. Repeat the exercise same as the other exercises. Straight leg raise will help to improve your muscle strength and which also helps to move your leg forward in walking and makes your walking easy. Next one, bed supported knee bending. Try to slide your foot towards your buttocks. You have to bend your knee by sliding your heel on the bed, and you have to hold this bending position for 5 to 10 seconds to improve your knee range. This exercise will help you to bend your knee with support and less pain. Repetition is same as other exercises. If you feel difficult for doing this exercise, you can take help from anyone with proper guidance. Next one, sitting supported knee bends. For doing this exercise, you have to sit comfortably with your thighs are supported either on bed or any table or any chair that is high enough to perform this exercise comfortably. Then you have to place your operated leg behind your strong leg and then push your operated leg back with the help of your strong leg. And you have to hold this position for 5 to 10 seconds to improve your knee bending range. If you feel difficulty for doing this alone, you can take assistance from others with the proper guidance. After doing this exercise, you can make your knee straight and again hold for 10 seconds to improve your quadriceps muscle strength. Then, repetition is same as other exercises. Next one, unsupported knee bends. After doing supported knee bending exercise, you have to perform same exercise without the support. That means you have to perform this exercise with your operated leg alone. Here also, first you have to bend your knee backward and hold for 5 to 10 seconds and then make it straight, again hold for 5 to 10 seconds. Then repeat the exercise. Some other additional exercises also we have that you can perform along with these exercises. These are static hamstrings and VMO strengthening. Static hamstrings. Hamstring is the main muscle present in back of our thigh, and the main role of this muscle is the bending of our knee. The pain which is usually present before the surgery due to osteoarthritis can cause knee movement very difficult. People usually don't bend their knees because of this pain, and this will lead to the weakness of hamstring muscle. So, improving the strength of hamstring muscle is also important. For doing this exercise, you have to place a small roll of towel below your heel and you have to lift your knee 1 to 2 inches from the bed and try to push your heel down to the towel. This will help to make your hamstring contract. And holding this muscle in this contracted position for 5 to 10 seconds will help to improve the strength of this muscle. Repetition is same as other exercises. The other one is VMO strengthening. VMO, that means vastus medialis oblique muscle, which is the main muscle usually gets weak in osteoarthritis. So improving VMO strength is also necessary. Here, you have to keep your knee in 70 degrees of bending position and you can place either a small roll of towel, a pillow or a ball in between your knees and you can press your knees together. This pressing will cause the contraction of this VMO muscle. Hold for 5 to 10 seconds. It will help to improve the strength of VMO muscle. Repetition is same as other exercises. Now, we'll move to walking activities. Walking can be started soon after your surgery. You will begin to walk in a short distance on the day of surgery itself. Early walking will fast your recovery and helps your knee regain its strength and movement. For stair climbing also, you may need assistance for some times and you will get proper training and advice for doing the same. For proper use of these devices, proper measurements according to individual comfort is necessary. In my next video, I'll explain the proper use of walker, crutches and canes in walking and stair climbing. Next is advanced exercises. You can start advanced activities and exercises after 5 to 6 weeks of your review with doctors to make sure you are strong enough to perform these exercises. Full recovery may take time, but these exercises will help you to get more better recovery. First one, knee bending in standing. Here, standing erect with support, you have to bend your knee up to 90 degrees and hold for 5 to 10 seconds, then make it relax. Repeat the exercise. On progression of muscle strength, you can add resistance or comfortable weight to this exercise. Next one, knee straightening in sitting. Here also you can add prescribed weight or resistance and make your knee straight. Then hold for 5 to 10 seconds and then make it relax. Repeat the same. Next one, SLR with weight. Here you can include weight for doing straight leg raise exercise. Holding and repetition is same as other exercises. Next one, squatting. Wall squatting with proper guidance will also helpful in advanced activities to improve functions. In home advice, I would like to tell you something important. Your knee may still be painful after you left from hospital. Small swelling around your knee joint is expected. So don't worry about all these things. Whatever things you have to do is, first you have to do regular exercise in proper way. You have to watch your knee wound properly. How to take care of your wound, your doctor will advise you clearly before giving you discharge from hospital. But if you develop any unusual redness, warmth or any fever, don't wait. Contact your doctor. So, these are all about osteoarthritis and its treatment. Hope this video will be helpful for all of you. Before winding up, I would like to tell something. Recovery is an acceptance that your life is in shambles and you have to change it. It takes time, it takes patience. It is your moment of decision that your destiny shapes.